Hi everybody, Dr. Daniel, and today I'm talking about the side effects of acute therapy migraine drugs. Well, everybody wants to know what side effects of drugs are if they take a drug, and so I've tried to put a list together of the most common ones that persons would take, and these generally are going to be over-the-counter drugs, prescription drugs from doctors. Along with there also is caffeine, which a lot of people don't see as a drug, but it really is. And the American Headache Society says that's the number one drug in America that persons take daily, is coffee mainly or tea, that can cause medication overuse headache. So if you're a headache doctor, the number one diagnosis for your patients when they come in the office is going to be medication overuse headache, which is a syndrome of frequent headaches that come from overtreating. And also then there's a thing called chronic migraine. Chronic migraine is defined by the International Classification of Headache Disorders as being at least 15 headaches a month, 8 of which have migraine features. So those are the common things that people get from overtreating and medication. All right, next, over-the-counter drugs, let me talk about those. Those are usually going to be Tylenol, Advil, or Aleve, or caffeine. And these drugs, mainly their side effects there are going to be GI, so they can aggravate gastric reflux or give you what's called heartburn. They can also aggravate anyone that has an ulcer or what's called just GI problems. So that's the main thing they may have. And the other thing I need to say is, some persons are more sensitive to headache medicine or any kind of medication than other people are. That's just the way the world is. So new patients may come in, they list, their health problems. They have a whole list of drugs they can't take, and it's just really hard for them because they're limited in what they are actually able to take. So first I want to talk about with this list about Tylenol, which is also called acetaminophen, and that's a non-opioid analgesic drug. It means a painkiller. Now, opioid drugs would be like hydrocodone or morphine, which are prescription drugs. You have to have a narcotic license to write them. And those can lead to addiction and they cause chronic headache. And then the other drug we don't want to be taking is like Fioricet, which is a combination drug that has mainly barbiturate in it, and it also has Tylenol and has some caffeine in it. So those drugs really should never be given to anyone for headache because they're so deadly for causing medication overuse headache. And in fact, the Fioricet drug with barbiturate has been banned in every country in the world except Canada and the United States, and we can't get rid of it here. So Tylenol will have the GI side effects as listed. You may also have a possible hypersensitivity reaction to it. It can damage your kidneys and your liver, and it can cause anemia or low platelets. The next one I want to talk about would be Advil, which is also called ibuprofen, and that's termed an NSAID, and that's a mnemonic, which means non-steroidal anti-inflammatory drug. There's about 12 or 15 drugs in that class, but ibuprofen is the most common one that people use. And so this is a painkiller drug that mainly also has GI side effects like I listed before, and can also have symptoms of acid reflux, gas, bloating, diarrhea, and things like that. The next to mention would be Aleve, which is Naproxen, lasts a little longer than Advil, also has mainly GI side effects. This drug can also be taken for folks for other kind of painkillers, like athletes will use it for aches in their back or knees and joints and things like that. Next I'll mention caffeine, which we mainly get in coffee or in tea or in chocolate. It's unfortunate this happens. Caffeine is an addictive drug. When Coca-Cola first came out, early 19th century, they had to get approval by the Drug Administration in America to be used because it was known to be an addictive drug. And the current diagnostical manual of psychiatry lists it as an addictive drug there. Anyone who's taken it knows what it's like, caffeine. So caffeine is a frequent cause of daily headaches. The other thing it can do is kind of hype up your adrenal gland and symptoms from that. So it can cause quick thinking. It's good for athletics. It can help in that regard. Some people do testing better, so students will take it before they test. It can give you a feeling like you don't need to eat, so you're kind of anorexic and don't want to eat anything, or you have trouble sleeping. And it can also make you have elevated pulse, and you can feel like palpitations in your chest. Next, I want to mention Tryptons, and now there are 7 Tryptons, and they all came out name brand, but they're all listed as generic. And they probably are now still, since 1991 when the first one came out, which was injectable Imitrex subcutaneous 6 milligrams, and now is known as sumatriptan. They're also, that's the only injectable one. The rest of them are nasal sprays or pills. And they're all similar in kind of effect, although there are 2 long ones, like Prova, that last longer. And all these drugs have similar side effects, although there are some exceptions that I'll go into in just a minute. The International Classification of Headache Disorders states that if one takes an over-the-counter drug, as I've mentioned before, more than 15 days a month, that could lead into medication overuse headache. And if you take triptans more than 10 days a month, that can lead it into medication overuse headache. So usually triptans cause a tight pressure feeling or burning feeling in your chest through here. It can also make you dizzy or drowsy. There are a long list of other symptoms, but those are the most common ones in my experience. Next, I want to talk about DHE, which is dihydroergotamine, and that comes as a nasal spray you squirt up in your nose called Migraine. And a little lower dose can be found with intramuscular injections, which patients can be instructed to give in their thighs. And I've given a prescription to a lot of folks who've done that, or in a hospital for treating kind of rebound medication of his headache. The doctor will use IV DHE to kind of get the patient where the headaches are better without giving them more painkillers or opiate narcotics or things like that that'll worsen the syndrome. Now, the most common side effect from taking DHE is nausea, vomiting. It can also make you have tight feeling in your arms and legs, particularly, and it can cause decreased pulse sensation in your ankles. Then I want to mention Timolol, which is a beta blocker eye drop. And I came to this drug about 10 years ago at a time DHE, which I usually use in a clinical situation of someone with medication of his headache, where you could give them DHE, it would treat their headaches while they're getting off of their other drugs, their painkillers. That's hard to do if you can't get DHE. But we found that Timolol could work then. So Timolol is a beta blocker, and the beta blocker drugs, this confuses a lot of folks because Inderal, which is propranolol, or atenolol, have been used. Inderal is the longest drug for prevention of migraine approved by the FDA that came out for approval in 1974. But that drug is taken as a pill. You have to take it every day. We're talking about a drug that's an eye drop you put in your eye as a drop, and it can treat headache acutely. So Timolol originally came out for treating glaucoma, but this is used what's called off-label for treating headache. And it can give headache relief very quickly, and I've been very impressed by how well it works for a lot of folks. It's not a narcotic or anything like that. Side effect profile is not very great either. Most persons, when I would see them back, there's either no side effects that usually work for headache, or it may cause a little stinging or blurring, and just get the patient to get a little Kleenex and dab their tears, and that's all you got to do. Next, I'm discussing a new class of drugs that came out in 2020, and there are 3 drugs in this list. The first is Ubrevi, which is a calcitonin gene receptor drug. It's a blocker. The deal in there is that migraine causes the release of 3 inflammatory neurochemicals, one of which is abbreviated as CGRP. So this drug, Ubrevi, blocks that in a sense. And you can have side effects of hypersensitivity reaction with hives and things like that, also with tightness of breathing and a little nausea or sedation. But most folks do pretty well and don't have as many side effects in general, really, probably as triptans. But the problem there is that they don't really work as well. The triptans, they're name brand, they're very expensive. Next, I would mention Neurotech, N-U-R-T-E-C. It's over-the-counter, OTC, and 75 milligrams. That's the only drug that's ever come along down the pike of migraine treatments that's been used for acute therapy, treatment for migraine. That's why it first came out in 2020, but in May of 2021, the FDA gave approval for this drug to be used for prevention of migraine also. So this is the only drug in the world that can be used for prevention and acute therapy for migraine. Now, the drug has rare side effects, again, of nausea, sedation, and things like that, but not a whole lot of side effects. The dose for prevention is given 75 milligrams every other day, or you can take 1 at onset. The last of those new drugs would be Raval, which is a drug that accelerates the release of serotonin, which is good for migraine. And this drug has mild sedation. It should not be used in persons who are taking like tranquilizers like Tylenol or Xanax or alprazolam because it causes sedation. It also shouldn't be taken along with alcohol or used with any opiate narcotic. It has a limitation that one should not drive for 8 hours after you take the medication. But I understand that's kind of a thing the FDA has put on this drug as a warning. But you can lower the dose and it seems to be better accepted. Not a lot of folks have that symptom, although it is a worrisome symptom as a side effect. The last thing I would mention would be occipital nerve injection. It's a really cool thing which you could do in the office. Particularly I use this for people who are having a week or two of headaches from overtreatment, or a month, or even anybody who has medication-induced headache or chronic migraine while you're waiting for other preventive drugs to kick in and work. Like one of the new CGRP blockers like Aimovig or something like that. You can give them a shot of cortisone and xylocaine. You give it in the back of their head in the occipital nerve distribution. And that could give great headache relief for sometimes weeks or a month or so. Okay, these are my thoughts on the side effects of the use of drugs for treating migraine. I have a more thorough discussion of all this on my webpage at drmigraine.com, and that's spelled out DOCTOR, migraine.com. I have it listed on my podcast where I talk about it in more detail. Please look at other YouTube videos I have on all of those different drugs separately. Please click like down there, and I'll see you again on the next talk.